Hi, my name is Nicole Vargas and I am talking about of ribavirin for chronic hepatitis A virus infection in transplanted recipient. Definition. Definition: hepatitis B, E virus and the sigils HEV is a unconsidered, non-enveloped, single-stranded RNA virus that is approximately 27 to 13.4 in diameters, 2 and 6. It has been classified as the single member of the genus Hepativirus in the family Hepativirus A. The antiviral drug ribavirin can clear chronic hepatitis A virus in solid organ transplantation research reported. And XAV infection is usually self-limited except in patients with suppressed immune systems, where it can envelop to chronic hepatitis and cirrhosis. Sorry.
Virology at the University of Leuven in Belgium.
I am Jan de Bing, I'm a pharmacist and a third-year PhD student in Johan's lab.
We will present our recent paper in gastroenterology, which is entitled "A mutation in hepatitis E virus RNA polymerase promotes its replication and associates with failure of ribavirin treatment in recipients of organ transplant." The study is a collaboration with the group of Professor Heiner Wedemeyer at the University Hospital in Hanover, Germany. 15 solid organ transplant patients with chronic hepatitis E were treated with ribavirin. All patients cleared the virus except 2 who were non-responders. The first patient received 1 course of ribavirin, and following treatment the viral load decreased, but even during treatment a viral rebound was observed, and following stop of treatment a fulminant hepatitis developed and the patient finally died. A second patient, viral load decreased again,
The possible residue at its position. The clinical pattern that we observed reminded us of the development of resistance against an antiviral drug. And that's why we introduced this mutation at position 1634 into a subgenomic hepatitis E virus replicon, and we tested its sensitivity to ribavirin in vitro. As you can see in panel A, these are the dose-response curves for the antiviral effect of ribavirin in glycine and arginine, and as you can see they're over.
And next, a positive and negative aspect of ribavirin. Positive. And ribavirin is a general antiviral that inhibits replication of many RNA and DNA viruses. It has long been used to treat hepatitis C, along with pegylated interferon alpha, and now several direct action and HCV agent. Negative. Ribavirin is a safe treatment option for HEV infection. However, the optimal dose of ribavirin for the treatment of chronic hepatitis A remains to be determined, as treatment failure may occur.
new, recently described human hepatitis virus. It's actually the fifth human hepatitis virus that's been described, and it's hepatitis E. They're named alphabetically from A through E. There are outbreaks almost every year in India, Pakistan, of tens of thousands of cases of hepatitis, with a 10 to 20% death rate in women who are in the last trimester of their pregnancy. So to me, this is a public health emergency that's not being dealt with. And hopefully with more attention to global health, hopefully the situation will change, and we're hoping that it will.
Hepatitis E, while a particular problem in the developing world, is common in the United States as well.
And his pig. So he apparently acquired it as a zoonotic infection from his pig. We decided in following this up to do a study of the U.S. population. And there is a population, a study that you may know of, run by the CDC, called the NHANES, the National Health and Nutrition Evaluation Survey. It's a randomized survey of the U.S. population, about 18,000 people. Well, somewhat more than that, but about 18,000 they had specimens left. So we obtained these specimens from the CDC and tested them for hepatitis E. And we found that 21% of the U.S. population had antibodies to hepatitis E. Now we're beginning to recognize that this is an important virus. And now with the added twist of people who are immunosuppressed going on to chronic disease, all of a sudden, the whole issue has changed. And the title of actually my talk today was the emerging epidemiology among globally and among immunosuppressed patients. And there are, just a couple papers because nobody's really wrote it so far. And the problem is, when somebody who's immunosuppressed and is on 10 different drugs, if the liver enzymes go up a little bit, you may not attribute that to an infection. It's probably, a reaction to one of the drugs. So it hadn't been studied. There's just a couple papers, and now there's one case also reported from England of an AIDS patient who developed elevated liver enzymes. He was on a lot of antiretroviral drugs, but he developed, and they studied him for hepatitis E. And in fact, he's carried the virus. So, given our current the population, the various susceptibilities, I think it needs to be evaluated.
Side effects. The main side effects of the drugs was anemia, which necessitated a dose reduction in 29% of patients, and erythropoietin 4%, and blood transfusion in 12%.
So I'm Dr. Carolyn Cooper, and I'm going to talk about hepatitis E. Hepatitis is inflammation of the liver, and hepatitis E is inflammation of the liver due to infection by a virus called hepatitis E. Hepatitis E is quite uncommon in the United States, but it is transmitted by contaminated water and uncooked foods. It is most prevalent in Southeast Asia, India, and Mexico, but is not very common in the US. Signs and symptoms of hepatitis E are usually very mild: jaundice, fatigue, abdominal pain, anorexia, maybe nausea and vomiting. It can be much more severe in women in their third trimester of pregnancy for unknown reasons. The treatment of hepatitis E is supportive care. It never progresses on to chronic disease. And the prevention of hepatitis E can be instituted by frequent hand washing with soap and water after using the bathroom, changing diapers or preparing food, and avoiding water and ice of unknown purity, and making sure that vegetables and fruits are peeled by the traveler or individual.
After more than a year of scrambling an infection by China's State Food and Drugs Administration (SFDI), hepatitis A vaccine developed by Chinese scientists.
Commonly with a hepatitis B and hepatitis C. In the United States, it's probably more common with a hepatitis C, and we have a lot of achievement in terms of the treatment for the hepatitis C. So a lot of exciting and very effective medications have come out. It's really promising for people with hepatitis C. So the hepatitis B is a little bit different. This is a chronic condition. It's more common in the Asian population. However, because of the immigration, we do see a lot of hepatitis B infection in the clinic as well. And this patient needs, the care is slightly different than hepatitis C because of the nature of the disease. So I feel like the hepatitis is quite interesting in terms of their management. Chronic hepatitis B depends on this virus is because of it's a DNA virus, so it's very difficult to use a medication to clear this virus. That's why it's very hard, not like hepatitis C. It's very hard to cure hepatitis B. Hepatitis B management is different based on the viral replication, based on different phase of the hepatitis B infection, and also depends on the patient's other conditions such as co-infection with a hepatitis C and or with HIV. And the other thing for the hepatitis B is interesting is even if people have immunity or they have previous have the hepatitis B infection, when they become sick, such as when they are during the have the chemotherapy for other cancer, so the hepatitis B can be reactivated and people can be very sick from that. We do have treatment for the hepatitis B, and the other thing is for the hepatitis B, people don't usually, if it's a chronic infection, people don't usually have much symptoms. So what we typically do is to keep a close eye on the liver, is because of hepatitis B can have increased risk for cancer even without progressing to cirrhosis. So this is one big part for compared to the hepatitis C. So this routine follow-up and close monitor is very important for the hepatitis B management.
And conclusion, this retrospective multicenter study showed that ribavirin has monotherapy may be effective in the treatment of chronic HIV infection. A 3-month course seemed to be an appropriate duration of therapy for most patients. Thank you.